Bushnell University's plan to double its nursing program numbers gets a boost of more than $4 million in grant funding. Staff in the School of Nursing say most of those nurses will stay local, beefing up Lane County's healthcare workforce. The Oregon Health Authority says overall the nursing workforce has grown in the state by over 15% since 2020. But only about 74% of the state's licensed registered nurses were practicing in 2023. OHA says the state's education programs only graduate enough nurses to fill about 72% of free spots. Those are numbers Bushnell University's School of Nursing hopes to change. The school brought in 3 major grants last year to grow its accelerated Bachelor of Science in Nursing program.
It's really addressing this lifespan of growing our healthcare workforce. It's not a quick fix. Educating a student in the field of nursing takes time, it takes money, and it takes expertise. So we're trying to take this setting and make sure that we're training our students in the most culturally conscious ways to provide really equitable health care. The community is really coming together to support our efforts to expand the healthcare workforce. It's helped the university design a state-of-the-art nursing simulation lab. Funds will also enhance recruitment and training and funnel students to Peace Health for a nurse mentorship program. Recent grant funds have allowed Bushnell to double its capacity in its nursing program from 32 to 64. Now, 80% of those graduates will stay in Oregon, 60% will stay in Lane County. We are getting some students from out of state to come here and then who do return to their home states, but most of our students are homegrown and they're staying in Oregon. Peace Health is one of the partnering organizations through one of the grants. Last year, the hospital announced the opening of an inpatient psychiatric hospital, and they'll break ground next month on an inpatient rehabilitation hospital. So the need has grown.
We are growing and needing more nurses for sure. Our mission and our values align very well with Bushnell. And so as nursing students are going through their programs, they're already being introduced to the mission and the values that Peace Health has. And then the other benefit of partnering with Bushnell is one, it means that we're recruiting from locally generally, and hopefully with the goal of retaining nurses in our community. Peace Health, as the biggest employer, the biggest hospital system in the region, does capture a lot of our graduates. But we have students going to Mackenzie-Willamette. We have students going to outpatient facilities. We have students who feel called to work in the elementary schools as school nurses. The way we rotate our students through the system, they have a chance to be exposed to all types of nursing, including community health.
The ASBN program takes students who already have an undergraduate degree in a related field like biology and graduates them within 12 months. And the program gets a new cohort of up to 32 students every 6 months. Gilbert says they've graduated 5 cohorts since 2022, and they have a 100% passing rate on the test required to practice as a registered nurse in the United States.
Bushnell's grants all came in between April and December of last year. The Lane Community Health Council grant of $2.5 million helped the school build program infrastructure. In November, Trillium offered another $500,000 to fund admissions, advising, and hiring faculty. The final grant of $1 million in late December came from the Higher Education Coordinating Commission. That grant created a partnership between the school, Peace Health, and Lane Workforce Partnership. LWP provides wraparound services like living stipends, bus passes, and food bank access to students. And those who go on to practice at Peace Health will then have access to nurse mentorship. All of the grants were funded in part through American Rescue Plan funds.